Welcome back. Back pain can be a common injury for golfers, but Hartford Healthcare is helping players get back on the course. And today we're talking about why golfers are at risk and what you can do to protect your back. Joining us this morning, Dr. Anthony Viola, orthopedic surgeon specializing in spine surgery at the Connecticut Orthopedic Institute. Doctor, thanks for being with us. And as a golfer, I know that it's a sport that requires a repetitive motion over and over again. Is that one of the reasons why these back issues are so common among golfers?
Yes, yeah, thanks for having me. I really appreciate it. Yeah, of course, the repetitive motion, that repetitive twisting, puts a lot of strain on the low back, and a lot of the injuries that occur related to the lower back muscles.
What do you do if you have a back injury from playing a lot of golf? What's the course of treatment?
The first thing we typically do is I say, if you notice that it happened during a swing, make sure you rest, you stop swinging, take a break for the day. You can ice it, you can take some anti-inflammatories, and then definitely stretch it out. If it lasts for a few weeks, I would say probably talk to your doctor about it.
Doctor, you mentioned stretching. Do you recommend stretching before and after you get on the course?
Definitely. I think it's something that is the most important. And if you talk to any physical therapist, they'll tell you that they can really prevent people from getting these injuries. And a lot of professional athletes have trainers that will work with them before and after their round, and that will help decrease the rate of the injury.
I've also noticed over the years there have been a lot more kind of gadgets that have come out, these heavy clubs that you can swing to kind of loosen up. Do you think these are a good idea to use?
I think the best thing more than any certain gadgets is just, if you are an avid golfer, meet with someone for lessons and have them work on your mechanics and just really make sure you're doing the right type of swing, because if you're doing the swing incorrectly and
Right.
then you're using a new gadget, that could lead to more injuries.
Yeah, what about strength training in the gym? Does it help to build up muscles around the back to give you a little bit more protection?
Absolutely. The big ones are the core muscles, obviously the abdominal muscles and the low back muscles. So if you go to the gym and you really focus on those, that's what the personal trainers for these professional athletes work on. They work on the core muscles that focus on the abdominal muscles and the low back muscles because of that twisting that happens in that area of your low back.
And at what point should you just say, this is too much for me to deal with on my own? I need to go see a professional, see a doctor like yourself.
I would give it, if you're trying anti-inflammatories, ice and resting and maybe some heat and stretching at home, and it's lasting more than 2 to 4 weeks, I would say give your doctor a call, probably your primary care doctor first. They may want to order some x-rays or even an MRI and make sure that this isn't just a muscle injury, that this could be a disc herniation or something else that we need to take a look at.
And doctor, I have to ask you, are you a golfer yourself? And have you ever dealt with any back pain?
I am a golfer. I try to play as much as I can when I'm not in the operating room. But yes, of course, I've had back injuries here and there with my golf swing, and I think if I did a little bit more work with a personal trainer or even got some more lessons, I think I'd probably reduce my rate of injury as well.
All right, doctor, appreciate you. Best of luck with everything and that golf game. I'm right with you, trying to get a little bit better.
Great, thanks so much. Thanks for having me.
Thanks for being with us.